In this module, I want to introduce some terms that you'll use not only in periodontal surgery, but also oral surgery applications. The first term I'd like to introduce is primary or first intention healing. The definition is when you have primary union of a wound in which the incised tissue edges are approximated and held until union occurs. Clinically, it appears as you see in this clinical photo. Here, the wound margins have been approximated in both of the sites. There is no openings or gaps that are present. Since these wound margins are approximating one another and the incised tissue edges are held until union occurs, this is an example of primary or first intention healing. The second term I'd like to introduce is secondary or second intention healing. This is wound closure wherein the edges remain separated and the wound heals from the base and sides via the formation of granulation tissue. In this example, think of oral surgery. This is the typical healing that you will see following extraction of a tooth. In this clinical photo, you can see healing that is taking place on both the right and the left sides at approximately 2 to 4 weeks following extraction of molar teeth. Since the wound margins weren't originally approximated and held closely together, and you can see the formation of granulation tissue and actually some maturing of epithelium, this is the definition of secondary intention healing. Our last term that we need to define is tertiary or third intention healing. Now this relates to delayed primary closure and probably is something that you won't see that often in dentistry unless you go into oral surgery and are treating trauma. This is done whenever you have a heavily infected or contaminated wound in which you need to leave the wound open several days following tissue injury. It is not until the reduction of inflammation and bacterial count or infection is observed when you close the wound itself. Primary closure is not attempted until this reduction in inflammation and bacterial count or infection has occurred. This concludes our module on additional wound healing terms.